Hello, my name is Lauren. Today we will be talking about COVID-19 and its vaccine. First, what is COVID-19? Well, it's a harmful virus that is spread through droplets, which are created when we talk, cough, and sneeze. These droplets can spread through the air and enter a person's nose, mouth, or eyes. When droplets land on objects or surfaces, the virus can survive for days, which is why it's important to wash your hands and clean surfaces frequently. If infected with the virus, several different symptoms can occur, such as a cough, fever, chills, and chest pain. Now let's talk about some myths associated with COVID-19. First, can you always tell if someone has the virus? No, it can take up to 14 days after exposure to COVID-19 to become sick. Some people also might have mild symptoms, or no symptoms at all. However, these people can still spread the virus despite not feeling sick. Next, anyone is at risk for contracting COVID-19, regardless of age, race, ethnicity, or health conditions. And lastly, wearing a mask will help prevent the spread of the virus if worn properly, meaning that it covers both your nose and mouth. Wearing a mask helps protect you and those around you. Now, here's Jana with more information about the vaccine.
Hi, my name is Jana, and I'll be describing how the COVID vaccine works. So there are two types of COVID vaccines, Pfizer and Moderna, both of which are messenger RNA vaccines, or mRNA vaccines. Unlike other vaccines, mRNA vaccines do not contain a live virus or a weakened version of the virus, meaning that you cannot get COVID from this vaccine. These types of vaccines may seem relatively new, but they have in fact been rigorously tested and studied for over a decade. So the COVID vaccination process happens in two steps. First, you receive an initial dose of the vaccine, and about 3 to 4 weeks later, you will need to obtain a second dose of the vaccine. You will need to obtain the same type of vaccination, meaning if you receive the Pfizer vaccine as your first dose, the second dose will also have to be a Pfizer vaccine. The vaccine is most effective after the second dose, so if you only obtain the first dose, it will not be as effective. Now here is Melanie to tell you who should get the vaccine.
Currently, the COVID-19 vaccine is available for those who are at a higher risk of becoming infected and spreading COVID-19, such as healthcare workers, adults 65 and older, and long-term care residents. But the COVID-19 vaccine will be available to anyone who wants the vaccine based on eligibility and the phase of the vaccine program. One of the key factors to ending this pandemic is reaching a herd immunity, meaning a percentage of the population needs to have had the virus or is vaccinated to prevent further spreading of COVID-19. At the moment, medical experts do not know the percentage of the population that needs to be vaccinated to reach a herd immunity. For this reason, it is recommended to vaccinate as many people as possible to reach a herd immunity. Now, here is Esmeralda to tell you more about the health benefits of the vaccine.
Hi, I'm Esmeralda, and I will be going over the health benefits of getting the vaccine. The vaccine is important to receive because it will keep you and your family safe by preventing the spread of COVID-19. The vaccine can offer immunity from COVID, minimizing the chances of getting the virus, along with many of its serious and sometimes life-threatening complications. Experts believe that the vaccine may also prevent you from getting seriously ill, even if you do get the virus. The vaccine will be an important tool to stop the pandemic. Following the CDC's recommendations and the vaccine, it can help reduce the spread of COVID-19. Now Jana will describe in further detail how the body builds immunity. mRNA vaccines contain specific genetic material strands called messenger RNA, or mRNA for short. mRNA is essentially instructions for cells in our body about how to make specific proteins that will then go on to perform a specific function. For the COVID vaccine, this mRNA contains instructions about how to make a part of a protein that is specifically unique to the COVID virus. It will only tell the cells about how to make a specific part of this protein, not the entirety, Therefore, it poses no threat or harm to the person. Once that protein piece is made, the cell breaks down the mRNA and disposes of it. This protein that remains causes the immune system to start producing antibodies and activates the cells in the body to fight off what they believe is an infection. This creates a memory response, meaning that if the body comes across this specific protein from the COVID virus in the future, the body will automatically recognize it and begin the immune response to fight it off.
You can get access to the vaccine by contacting your doctor, the Centers for Disease Control and Prevention, or other local healthcare facilities. Another reliable source is to check out the LA County Department of Public Health website for more information about the vaccine and how to book an appointment. Be aware of fake providers or spam websites. Do not trust disreputable websites or unknown callers. Thanks for watching.